Hi there. I just wanted to take a moment to talk to everyone as today is October 31st and it is the last day of the month where everyone gets really excited about wearing pink and celebrating pink and helping everyone to be more aware of breast cancer and with the goal that we will through our awareness, save more lives. Right now, we don't have a cure for us to never get breast cancer. We do have some great scientific, technological innovations that help us to detect breast cancer in its earliest stages, which are absolutely wonderful. So I wanted to take a moment just to tell you why I am so passionate about advocating and educating and talking to women about breast cancer and taking advantage of the early detection screenings that we have available to us. There are so many cancers that we can get, and this is one cancer that we do not have to die from. Um, you know, us women can get ovarian cancer. There's no screening test for ovarian cancer. And most of the time when people find out a woman finds out she has ovarian cancer, it's after she's become sick or started to feel the symptoms, and it's usually in the more advanced stages. And we don't have an early detection screening test for ovarian cancer. But for breast cancer, we do. And I am a strong believer in taking advantage of those opportunities that have been afforded to us. I started my breast cancer journey at the age of 10. My great grandmother, who I was very close with, I was close with her because when my mother was in graduate school, my grandmother and my great grandmother took care of me so my mother could finish graduate school. And I love them for that. I love my mom for giving me the opportunity to spend that kind of time with them. So at the age of 10, I remember that is when my great grandmother was diagnosed with breast cancer. And she went through a lot of treatment, one of which was a double mastectomy. And so I can remember being there and, during the summers and helping her with things. One I can remember, I don't know why so vividly, but she would get edema in her legs and I would help her put on her compression socks. And I just really enjoyed helping her do that because she couldn't do it by herself. She was in her 70s. So, I have those memories of, how I was able to connect with her even more through that journey that she went through. What I remember most about her journey is when we got the call. My dad was in the military, so we didn't live close by. When we got the call that my grandmother, her lung had collapsed, my great grandmother, her lung had collapsed. And we all got in the car and went to see her because they told us she wasn't going to make it much longer. And I remember being there in the hospital, and when it was my turn to go in, they didn't let us all in the room at one time. So when it was my turn to go in and see her, she was awake and she was alert, but she couldn't talk because her lung had collapsed. But I remember her eyes, and she was looking at me just like my eyes are just as clear to you right now. Her eyes were so clear to me, and we were just staring at each other in a glance, and I knew she was telling me that she loved me. And I can remember that day just like it was yesterday. I knew that she was saying, "I love you." But I always felt like she was telling me something else. It was just always a thought in my head, like, what else was she trying to tell me that she couldn't say? In around 2008, a good friend of mine who I work with, Angela, I won't say her whole name. Many of you know her if you know me. I'll show you her picture. This is Angela right here. Angela, we were passing each other in the hallway, and she said, "Hey, I need to take off early because I got to go to the doctor." And I said, "Okay, sure, you can take off. Take care of yourself." But I was also kind of shocked, like, "You going to the doctor?" Because she didn't go to the doctor for anything. So She told me why, that one of her breasts was, she was a large-chested woman, but one of her breasts was getting larger than the other one, and she was starting to have pain in one of her breasts, so she felt like she needed to go see what was going on. And a few days later, she came back and told me that she had breast cancer. Now, what we found out at the end, she was actually in stage 3 and 4. When she found out, she heard, or what she thought she was told, was that she was in stage 2 on one side and stage 3 on the other. But towards the end, she was told by her doctor that she was already in C. And when I walked in the room, it was so shocking. Like, I would not have known it was her. I thought I was in the wrong room when I saw her, or who I thought was her. But when she saw me, and she immediately opened her mouth and said, "Hey, oh my gosh." And her voice sounded like regular Angela. That's how I knew it was her. But she looked nothing like the Angela who was my friend and who I had known. And it was during that visit with her that I realized what my great-grandmother had been trying to tell me. Angela was not getting her mammograms. She wasn't doing a lot of things to take care of herself. But my great-grandmother, as we were staring at each other, and she was saying, "I love you," with her eyes, and it was like she was saying something else because she was a Spitfire. So I saw that in her eyes, that little Spitfire. Like, this is more than "I love you." She was saying to me, "I know now." This is my great-grandmother over here on this side. She was saying to me, "This stops with me. This is it. This stops with me." And I realized it when I was in that room talking to Angela. At that point, my anger of my friend being hurt turned into a passion. And I did not want to see anybody else go through what I saw her go through. I just felt like there was so much that I could do as one person to prevent someone else from going through what Angela went through. She did not have a history. Her mother was actually there when she took her last breath. When she took her last breath. She did not have a family history. So 85% of women who are diagnosed with breast cancer do not have a family history. D'Angela was my call, and I answered that call and heard my great-grandmother's voice. In September of 2010, I started getting my mammograms at the age of 40. In October, Angela passed away. I got my mammograms annually every year since 2010. I started becoming kind of a big mouth. I love social media, so I use that as my primary platform for educating and advocating and speaking out. And telling women to get your annual mammograms. There's so many exceptions to the rule about early detection, but the real issue is that many of us pass away simply because we are not taking advantage of the technology that has been afforded to us in the way that it was designed to work, which is get your mammogram every 12 months. Now, the age at this point is up for discussion, controversy, and I think that's a decision that you need to make with your doctor and a decision you need to make for yourself. Advocate for yourself. But get your mammogram. Do something. The problem is not what we did or we made, this screening or that screening, it's radial or thermal mammogram or a breast MRI. The problem is the women, I'm going to say women, men get breast cancer too, but I'm talking to the women right now. Women who don't get their mammograms, who don't partake in early detection screenings. That's where the problem is. And the excuses. I, myself, when I go out and talk or I'm in a McDonald's or a store, and I wear things all the time to spark conversation, and a woman oh, I love your pink, and I tell them why I'm wearing it, and they have it. I always ask them, are they getting their annual mammograms? And most times they're not. And they always have an excuse about why they're not. And it's not a valid excuse based on any scientific research. So I started getting my mammograms in 2010. And 2011, 2012, 2013, in 2014, I was diagnosed with stage 0 breast cancer. And I found out on my annual mammogram. My breast cancer was the size of a grain of sand. I remember when I went for my follow-up, I got the phone call, and I already knew then, like, oh gosh, they usually send a letter, but they just called me and told me they need me to come back in. So I kind of knew then, probably because I do have a family history, I kind of said, okay, it's my turn now. I did. I had this feeling like, I'm pretty sure it's breast cancer. I wasn't hoping, I was pretty sure it's breast cancer. So went back in, did what they said, and got the ultrasound done. My breasts are dense. I've always known that. My doctor likes to joke and say, oh, when you get older, your breasts will be so perky. It's kind of funny. But, the women on my side of the family have dense breasts. So one of the follow-ups was an ultrasound. My little cell was so small, the ultrasound wouldn't pick it up. So they, spent time trying to, do their part, go through all the protocol that they're supposed to. So I'm laying there, people come in, they couldn't pick it up from the ultrasound. So the only other, they did a more sensitive type of mammogram, and had me wait. That place that I go to does everything and makes you wait to tell you the results once you call back. So had me wait once they did the more sensitive mammogram, and told me that they needed me to come back for a biopsy based on that mammogram. But during that visit, they also showed me the film, and I couldn't believe how tiny it was. I had to walk up really close, with my face just a couple inches away from the film because it was so tiny. And then I saw these other clusters, and I'm like, well, what about that? What's that? And how did you know that one cell all of, over there by itself was a problem? And the radiologist was there, and the nurse, and the radiologist was just kind of like, well, I'm telling you this. So not arguing, but, I don't know what else to say you. I'm pretty sure it's breast cancer. We need you to come back for a biopsy. And his assistant, which I believe was a nurse, said, only a trained eye would have seen it. She said, this is the earliest possible stage you would see it. This is when you're supposed to catch it. And so I'm like, I still want to know how y'all caught that. And so, because it was so hard to see on that film, there's no way I would have felt that. My grandmother was getting her annual mammograms. She found out she had stage 0 breast cancer on an annual mammogram in her early 70s. Had very minimal treatment, a lumpectomy, a week of radiation, and went on with her life. My grandmother died at the age of a couple days before her 83rd birthday, laid down to take a nap and said, I'm going to take a nap, and died peacefully in her sleep. She did not die from breast cancer. My mother, not even a year before me, on her annual mammogram, got that call, hey, come back. Found out that she had stage 0 breast cancer. And because she was getting her annual mammograms, it was just like me, just like my grandmother, the size of a grain of sand. She had a lumpectomy and a week of radiation. Now, if your radiation length of time, it has to do with being premenopausal, postmenopausal, as well as some other things, but a big factor is whether you're still producing estrogen. And because I'm so young, I had to do a much longer regime of radiation for 35 treatments, which was 7 weeks. So it was like Groundhog Day. But I am okay. I have a little bit of a tan. can barely see where I had the lumpectomy. The scar's not even there. I can see a little bit of an indentation, but I don't really have anything to look at other than the tan, the very slight tan. And, I'm going to say I'm proud of that. I'm proud that my grandmother was taking great care of herself. I'm proud of my mom for taking great care of themselves and them always talking to me about making sure I start getting my mammograms. And Angela, I was at the age, so I was going to get it anyway. But Angela just brought that conviction out of me that to help save other lives. And I cannot stop because I don't do it because I was diagnosed. I started doing it in 2010. And I can't bear to watch someone go through that. It's very hard. And there's been friends of mine who passed away from breast cancer, and I've gone to those funerals, and they're very hard. I think about Angela and why, and I hope that you're hearing me and that me caring about you and your life compels you to take care of yourself and get that annual screening. So this is my mom, who I told you was diagnosed a year before me. Not a year before me. Probably about 9 months before me. This is my grandmother, who was diagnosed in her early 70s. I believe she was 73. Stage 0, lumpectomy, week of radiation, went on with her life. My mom, stage 0, week of radiation, after her lumpectomy, went on with her life. Here's me. Lumpectomy, week of radiation, and I've gone on with my life. That's me the day that my primary care physician called me in, because the way the medical professionals work at the places I go, they wouldn't have told you, or they won't tell you over the phone. So they told my primary care physician, they said, "Hey, can you come in?" And it was like 9 o'clock in the morning. I'm like, why? Well, we just need to, we need to go over your results of your biopsy. I said, "Okay, you want me to come in tomorrow?" "Well, can you come in today?" Like I said, I wasn't shocked because I already knew. But hearing you have cancer, and I was in my car after the visit, I decided to take a picture of my face. But I was really on a mission. I right away went and made that appointment. I went and got a copy of my mammogram results, my biopsy results, because I was on a mission to go ahead and get this taken care of. That was my face. So there we are, these women in my life who maybe want to help you to catch it in the earliest possible stage. We do not have to get sick to take notice. And I'm a strong advocate for that. We don't have to get sick to take notice. Not for this. So I'm asking you, ladies, make sure that you are getting your annual mammograms. Be a survivor. Being a survivor for me started with me. My great grandmother said, "This stops with me." So that meant me surviving started with me. And I want you to be able to say, "I am a survivor, and it starts with me." Get your annual mammogram. Early detection saves lives.